Tonight on the 10 o'clock news on KTVU Channel 2. Stressed out, this dentist says he could help.
It's incredible. Unbelievable.
KTVU's Bob McKenzie shows you how you could look and feel better. Tonight on the 10 o'clock news on KTVU Channel 2. Complete Bay Area news coverage.
And how can some dental work relieve pain in other parts of the body? We'll have the answer in tonight's segment 2. Those stories and all the news on this Saturday night, November 23rd, 2002.
Live from the award-winning Channel 2 newsroom. Complete Bay Area news coverage. This is the 10 o'clock news on KTVU Channel 2. The #1 primetime newscast in the country.
And can a change in the alignment of your jaw relieve major pain in other parts of your body? A segment 2 report that may surprise you. When we come back on tonight's 10 o'clock news, this woman's neck hurts. So why is the dentist working on her jaw? Bob McKenzie has the answer and how it might help your pain on tonight's segment 2. If you have a pain in the neck, you might have a problem with your teeth. A new field of dentistry called Neuromuscular Dentistry is treating ailments all over the body by repairing the jaw. And many who have undergone the procedure say it really works. KTVU reporter Bob McKenzie investigates on tonight's segment 2.
Anthea Tolomei is a fashion consultant who is very busy this time of year, but she is driven all the way from Berkeley to Santa Rosa to see a dentist, and not for the usual reasons. She has no cavities or toothaches, but she has other problems.
I have a lot of neck tension, a lot of pain back here if I'm under stress, and some people get headaches. Mine seems to gather in the upper neck and the upper shoulder region, and he explained to me that that's associated with my bite, which needs to be corrected.
He is Dr. James Klim, who practices a fairly new science called neuromuscular dentistry. Under its theories, when the jaws don't close together in the way nature intended, that can create such problems as headaches and neck aches and numerous other painful disorders.
Now, as we see here, you're having to bring your lower teeth back to get your jaw together. This area where we have the red dotted line, that's where your upper teeth are holding your jaw back.
Klim says most people's jaws close properly when they're young, but as we age, our teeth wear down, particularly in people who tend to clench or to grind their teeth while they're sleeping.
If you do a lot of clenching, it will actually bring your head forward and actually straighten out your neck, which activates the muscles on the back of your neck. So you can actually get the cramping there, and that's what the pain's all about.
And pulling the head forward to swallow or clench eventually leads to stooped posture, he says.
As we mature in life, our structures can change, and in those people that have a lower threshold, they can start picking up headaches, and here's the killer, is the neck ache.
Klim sets out to cure Anthea's neck pain by correcting her bite. To do that, he measures the tension in her facial muscles to find where the jaw action is creating strain. He will design new teeth for her that will crown her old teeth in a way that corrects her bite. She will also get an attractive new smile, though that's not her main concern. And Anthea has hope, though a faint hope, that the problem she doesn't talk about will also be corrected. She has a constant ringing in her ears. Another effect of rebuilding the teeth can be an improvement in the patient's looks, the result of lengthening the lower face. Michael Houlihan, the owner of a winery, looked like this before Dr. Klim rebuilt his bite, and like this afterward. Deborah Lee Shipley looked like this before seeing Klim, and like this afterward. Her lower face had shortened over time as her teeth wore down, and her facial muscles were sore. The new teeth lengthen her lower face, and she likes the effect.
I've been limping along for years on a bite that just didn't feel good to my facial muscles, but I didn't realize it until they were corrected, and then it's just a world of difference.
Give us that big smile. We were back in Santa Rosa a few weeks later to see how Anthea's new teeth would look. We should observe that not all dentists agree that neuromuscular dentistry produces all the benefits it claims, but the neuromuscular dentists reply, look at our results.
Okay, Anthea, what we're going to do is peel off our matrix here, and we're going to see your beautiful new smile. Wow.
Oh, wow.
Isn't that incredible?
That's beautiful.
Oh, wow. And she hasn't seen it yet. And I want to cry.
This is incredible. Unbelievable. And on top of that, no more neck pain, huh?
No more neck pain.
Wow.
And a few weeks after that, we talked to Anthea about her new mouth.
Now, the neck pain that was chronic and that you had whenever you were stressed, it's gone?
It's gone. I would literally have to move my entire body to look and speak to somebody during the season, and I took it for granted that this is just the way it was going to be for life. It was my stress that would relocate itself on my neck. But since having my jaw realigned and rebuilt, that has all subsided. Now, another thing that has subsided is the ringing of the ears. That surprised me. I thought I had heard one too many Led Zeppelin concerts in the late 70s.
At first, it seems unlikely that fixing the teeth can fix the head or the neck or cure a variety of symptoms. Yet Anthea is one of numerous people who testify that it worked for them. In Santa Rosa, Bob McKenzie, KTVU Channel 2 News.